Hello everyone, in this video we will be learning about radial nerve. Radial nerve begins from the lateral part of brachial plexus. Its root value are C5, C6, C7, C8 and T1. It is the largest nerve of upper limb. It includes all the roots of brachial plexus. Now let us learn how it passes through the upper limb. So in the region of axilla, it lies posterior to the third part of axillary artery and it gives three main branches. Posterior cutaneous nerve of arm, supplying the posterior part of arm, a branch for long head of triceps and a medial head of triceps. Then the nerve passes between the long head and a medial head of triceps, and then it passes through the lower triangular space and then pass to the spiral groove of humerus along with the profunda brachii artery, and in the spiral groove it gives off five branches: a branch for a medial head of triceps and a branch for a lateral head of triceps, and then it gives off lower lateral cutaneous nerve of arm for the lower lateral part of arm, and a muscular branch for anconeus and posterior cutaneous nerve of forearm. Below the level of lateral epicondyle, it gives three muscular branches: a branch for brachialis, and a nerve for brachioradialis, and another nerve for extensor carpi radialis longus. Then, after the level of lateral epicondyle of humerus, it terminates by dividing into superficial branch and a deep branch in the lateral part of cubital fossa. Deep branch is also known as posterior interosseous nerve, and in the region of cubital fossa it supplies to a supinator muscle and extensor carpi radialis brevis. Then it pierces this supinator muscle and then run downward in the posterior part of forearm, supplying all the extensor compartment of forearm. It supplies a nerve to extensor digitorum, extensor digiti minimi, extensor carpi ulnaris, adductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, extensor indicis, and then it gives two articular branches for inferior radio-ulnar joint and another articular branch for wrist joint. Superficial branch of radial nerve is sensory and it passes down the pronator teres brachioradialis. It passes down medial to radial artery. Then it enters the posterior side of forearm and then pass to the anatomical snuff box, and finally terminates as a cutaneous branch of lateral side of dorsum of hand and lateral 3.5 digits except nail beds. Now let us discuss some clinical correlations of radial nerve, which is the most important part. So radial nerve might get injured in the three regions: in the region of axilla, in the region of spiral groove, and at the elbow. Injury to the radial nerve in the region of axilla is due to the pressure of the upper end of a crutch. So it is also known as crutch palsy. So all the muscles and the sensory innervations which are supplied below the region of axilla, that is arm and forearm, are affected. Elbow is flexed due to triceps injury and wrist drop can be seen as wrist extensors are paralyzed, fingers drop due to paralyzing of fingers extensors, and sensory loss at lateral 3.5 dorsum of hand can be seen. And when there is injury to radial nerve in the region of radial groove, this is known as Saturday night palsy. And you can also see weakness in elbow extension because because the long head of triceps and the medial of triceps were already supplied in the region of axilla. So there is a weakness in elbow extension, which is a partial injury, whereas wrist drop and finger drop and sensory loss in the lateral 3.5 part dorsum of a hand can be noticed. If there is an injury in the region of elbow, then triceps injury is not involved, so there is no flexion of elbow, and weak extension at wrist can be seen because the extensor carpi radialis longus was already supplied before the level of lateral epicondyle, right? So as it has got injured in the cubital region, so this muscle is spared, so there is only weak extension at wrist, but finger drop is prominent and sensory loss at lateral 3.5 dorsum of hand is present. The branch of ulnar nerve can get injured in the radial head fracture, and during this triceps injury, wrist extensors are not involved, but finger drops can be noticed, and there will be no sensory loss in the lateral part of dorsum of hand. So that was all about radial nerve. Thank you for watching.